Patient 1, Heather, 22-year-old female, complaints of having a bladder infection, no major pertinent diagnosis. History of present illness includes burning when she urinates as soon as urine flows. First noticed in August while she was playing a sport. Has had bladder infections in the past. Last one was 2 years ago and stated this pain felt kind of the same. Has been urinating more frequently the past 3 days. Has vaginal irritation and some white discharge. She has mild suprapubic and lower quadrant tenderness bilaterally. Denies nausea, vomiting, constipation, and diarrhea. Denies urinary urgency, no distress. States she has a huge bladder. Past medical history includes medications of birth control tablets, PO daily. Occasionally misses a dose once a week. No allergies or immunizations are on file. History of chlamydia when she was 16 years old. Tubes in her ears at 18 months of age. Mole removed on her left leg at the age of 12. No hospitalizations. Family history includes heart disease and hypertension. She lives with her parents. She is employed as a waitress, smokes less than a half a pack per day, cigarettes, sexually active with her boyfriend, some condom use, and plays sports. Physical exam includes 22-year-old female, no distress, height 5'5", weight 122 pounds, afebrile, abdomen is soft and mild. Abdomen soft, mild, suprapubic and lower quadrant tenderness noted bilaterally. Test results, urine dip shows large leukocytes, no other abnormalities. Burning while urinate. Differential diagnoses include urinary tract infection, cystitis, and STD. For urinary tract infection, it is highly likely this is what's occurring with her because of burning while urinating, urinary frequency, mild suprapubic and lower quadrant tenderness bilaterally. For cystitis, it is also highly likely due to mild suprapubic and lower quadrant tenderness bilaterally. And then STD because of the history of chlamydia, vaginal drainage, and vaginal irritation, and occasional unprotected sex. Questions I would have for my preceptor would be, is it possible that the patient could have an ectopic pregnancy? And then number 2, is she a candidate for pyridium? Number 3, could we use our result from the urine dipstick to treat a UTI if we determine that is indeed the diagnosis? Case-related issue, my daughter had her son about 5 years ago. After she left the hospital, she began to have pain in her lower abdomen and a vaginal discharge. It was difficult for her to urinate. She initially thought she had a bladder infection, but instead was diagnosed with pelvic inflammatory disease. Second patient is Joe. He's 17 years old, complaining of itchy rash. Major pertinent diagnoses include eczema. History of present illness, 17-year-old male complains of itchy rash for the past 2 weeks, spread to his trunk and thighs, denies cough, wheeze, or shortness of breath. Girlfriend has noticed bumps. Brother has been itching. No history of asthma, denies runny nose or sore throat. Past medical history includes medications and just taking a leave over the counter for aches and pains related to football. No allergies or immunizations are on file. History of eczema. No history of hospitalization or operations. Family history not significant. Social history includes living with his mother and his brother. Plays football and wrestles and attends high school. Smokes half a pack per day. Physical exam shows 17-year-old male, height 70 inches, weight 176 pounds. Vital signs are stable, 92/50, respiratory rate 16, pulse 64, temp 98.2. Integumentary system, he has a rash on his trunk, a fine maculopapular red rash, widely scattered, extending a little bit onto the thighs, no rash visible in the antecubital areas or on the backs of the knees. No bumps between his fingers. There were no test results done. Differential diagnoses include poison ivy, allergic contact dermatitis, and eczema. With poison ivy, red rash on trunk and thighs, no bumps between fingers. Brother is itching, girlfriend has bumps, and then the possibility of secondary exposure is high. And then red itchy rash on the trunk and thighs and recent change in detergents could be a possibility for the allergic dermatitis. For the eczema, it is not likely because eczema typically affects the face, cheeks, hands, and fingers, and the patient is not infected in those areas. Questions for the preceptor would include what is a good app that differentiates the rash as well, and how often do you see secondary infection with poison ivy? case-related issue. When I worked at the nursing home years ago, our residents had an outbreak of what we thought were chiggers. We were able to identify the insect by the fact that the scabies buries its entire body under the skin to feed, and the chiggers did not. It was a difficult process identifying the culprit, but it was ultimately scabies that caused the illness. Thank you.